A complete eye exam is the only way to ensure your total eye health and to diagnose any eye-related health issues such as diabetes and high blood pressure. It is more than just checking to see if your vision is 20/20 and handing out a prescription. Many factors can affect the health of your eye, and a complete eye exam takes all those factors into account before taking further action. Your optometrist will use a number of techniques to assess any potential vision or eye health problems and will keep a file of that information in order to keep track of changes in your health or vision. Steps that you can expect in a typical optometry eye exam include a case history where you will be asked about your general health, medications you may be taking, your working environment, and your hobbies. You will also be asked to describe any vision problems you may be experiencing. An external and internal eye health assessment. Using either a slit lamp microscope or an ophthalmoscope, your optometrist will examine the external area around the eye and the internal structures from front to back to ensure there are no abnormalities or problems. Digital retinal imaging using a retinal camera is often done to capture and compare images of your retina over time. Problems detected during an internal eye exam may indicate possible disease, such as diabetes and hypertension. If your optometrist sees any of these warning signs, you will be referred to a physician for further testing. Next, your eye pressure will be checked with a technique called tonometry. Tonometry can be performed using an instrument that blows a puff of air into your eye or with a small probe that gently touches your eye. But don't worry, numbing drops will be used before the probe touches your eye. Tonometry is an important test in detecting glaucoma, a serious condition that leads to blindness. Your vision and prescription will be assessed using a couple of techniques. The first is an objective measure that is done without getting feedback from the patient. This can be done using either an autorefractor or a retinoscope or both. This is an invaluable technique for assessing the vision of children and those who may not be able to communicate. The second technique relies on interaction and judgment from the patient. Using the familiar eye chart, your optometrist will assess your ability to see small detail at both near and far distances. You will then be placed behind a phoropter, an instrument containing a combination of lenses. Lens choices are systematically changed based on the patient's response until a clear focus is obtained. Your eye movement will also be assessed using a number of tests to evaluate how well your eyes align or coordinate when working together or individually. Problems such as an eye turn or a lazy eye can be detected. Your peripheral vision or side vision will be checked to see how well you can see targets which are way out to the side and not directly in front of you. Diseases such as glaucoma, stroke, or tumors can be caught with this test. Other tests may be performed to evaluate your ability to change focus, to see color correctly, or to perceive depth correctly. Your optometrist will choose the tests required to adequately evaluate your visual system. Regular optometric care will ensure that proper vision is maintained at all times. The Canadian Association of Optometrists recommends the following comprehensive eye health examination guidelines. For children, an eye exam should be scheduled at age 6 months, then age 3, and again prior to entering school. For 6 to 19-year-olds, an eye exam should be done every year. For those over the age of 19, an eye exam should be done every 2 years or sooner if recommended due to contact lens wear or an eye health or vision concern.